a near insurmountable problem, and it just draws attention back to the long-term commitment that everybody needs to have to altering social determinants of health. And it's it's going to be longer than any of our lifetimes, but otherwise Philip's staff is just going to keep drowning under the weight of deadlines and applications, increasing applications. And it's not just the surge times of the year, but at any time of the year. That's all I've got. Greg, did you want to add anything?
No, I think that's pretty much summarizes the concern, and that is in taking this back in-house in terms of distributing money for energy assistance. We're taking it in-house, therefore we need support staff to distribute it. And without an adequate number of people to process that, we run the risk of having money that's not distributed to people who do need it. That will be returned to the state because we don't have the adequate amount of people to process the applications, distribute the funds, and the people who need it the most are, not everyone's going to get it.
Thank you, Greg. That's all we've got.
Oh, that's right. Yeah. Thank you so much.
I have a question.
Oh, absolutely. Sorry.
So just a thought, I think we all agree that this was a really good decision for the county to take this back on. And we recognize the challenge in workforce. I mean, everybody faces this, it seems like, in every industry. So we got a challenge. And I'm wondering, Philip and Stoney and others, in this space that you're in right now, and it sounds like it's a little bit more of a challenge, like an acute, urgent challenge. What is the capacity or the history or the experience of collaborating with other community agencies, not contracting, but collaborating in doing this work? Like there are other agencies that do energy assistance and applications and giving money and things like that, such as the Salvation Army or St. Vincent de Paul or ABCCM or other organizations. Could they be leveraged to help you? Not contract, but help. And has that ever been considered or a discussion or a forum to have that conversation with other community agencies trying to do this work to help you?
And that's a good point, Dan. What I'll tell you is that the problem with energy, and this is the problem we ran into with Evelyn, because it sits in NC Fast. And I would tell you, it's not like, I bet you we probably take 80% of our applications for the energy program, and Kelly could probably give you the right numbers, but electronically. I mean, people were applying through ePass. The rest of them either walk in the building or phone apps. We take a lot of phone apps too. But that's the issue we ran into with Evelyn. The cases still have to be processed in that eligibility system. And Evelyn had very limited quality access in the NC Fast because they were a contractor. So the only thing that community partners could possibly help would have people apply. And that would be some help, I guess, doing the ePass. That the work's still going to have to be processed internally within HHS. So you got to have the resources and the staffing levels to process that volume of work.
And Dan, I'll just interject from what we have seen this season. So we do have St. Vincent's Salvation Army, ABCCM, Evelyn. All of them are jumping in and they are doing energy pieces and parts. They have access to funds that we do not, so they can access and they can help our residents in different ways with different problems that our energy programs just cannot cover. So they are doing it. Again, like Philip said, it's that barrier piece. Just simple access within NC-FAST that contractors are not allowed to do, and makes the turnaround time for them even slower. And that's what it boils down to. What can they do? How fast can they do it? And they simply don't have the staffing levels and have not been able to maintain the staffing levels that it takes to do this program within NC-FAST and hit those mandated timeframes that we have to have.
Yeah, so that makes total sense. So now I understand why that would be a challenge to work with. I mean, to have the community partners help you. So Stoney, this might be like a policy discussion about the barriers of NC-FAST in using community resources to do the work. You know, like this sounds like this is a policy application barrier that could be fixed if if the right conversations are had with the right people at the state.
Well, my
think that's a good
understanding based
point.
on what Philip said earlier, Dan, was that NC-FAST is the IT program which all benefits are distributed, whether it's health, food, in this case, energy. So collaborators, nonprofits don't have full access to the NC-FAST method. Therefore, it falls back upon state agencies to take that in-house. So, and that requires more staff.
But that's
I think-
exactly the point, though, Greg. If one of the ideas from HHS was to develop this NC Care 360 system, that where everybody is having one platform for identifying the person, having the data in the system that everybody then can see. It seems like the NC-FAST system is not keeping up with the vision of having a platform that community partners can all participate in, working referrals, managing the system. So I recognize the barrier right now, but maybe it's an opportunity to open up NC-FAST to more community partners.
And that, you know, that's the point I've made, safety net meeting and with the NC Care 360 folks and stuff. It seems like to me that a lot of that information to determine eligibility, whether it's at HHS or it's at community partners or whatever, may sit in NC-FAST, but there is no bridge to that NC Care 360 system to be able to extract that information. And that you know, so you're ended up, if somebody needs help from 2 or 3 different agencies, at times you're determining eligibility in 3 different places, asking for some of the same information and they already.
A perfect point to bring up, Philip, at our NC Care 360 Summit. Let's push this. I mean, let's push for this type of integration. This is the problem, is the lack of integration of these systems, right? So anyway,
Yes,
I think
I would agree.
Yeah.
And also, unfortunately, some of the limitations come from the feds, which we really can't do a lot about in terms of the deadlines that they have to meet. But that would be great. I'd be way behind that.
And that is why you have limited access to NC-FAST from contractors, is because of the feds. I mean, because that is federally protected information that sits there, and it will become even more so when you start to move most of the child welfare system into NC-FAST.
Yeah.
And so my
Dan, I
concern is that if our best shot is to change something that is fairly rigid and has been a challenge from the very beginning, you know, is there some other better shot that we can anticipate for this upcoming year that will allow us to distribute more funds and send less money back? And I think that's where it kind of comes down to, do we even have the staff necessary to work within what we're going to be working with next year to distribute the money? But your point is well taken. I mean, systematically, there are ways in which it sounds like it should be more fluid, more efficient.
Dan, I would like to thank you for bringing up a good idea, though. And like Kelly said, we really started down that path this year. If you go to the back into the history of this program in Buncombe County, pre-NCFAS, Philip, y'all tell me, I think it was pre-NCFAS, we actually distributed these funds across the community. So we had various partners distributing these funds. So we had like Swanano Christian Ministry, ABCCM was a partner, and Eblin. And so like the funds were out in the community agencies. And so wherever you lived, you could come in where you lived and get energy assistance. When this program was put into NCFAS, it really squeezed it a lot, and it almost squeezed it, I mean, systemically, it squeezed it into one agency, and then even then, there were system barriers where the state system that owns this system would not give a contractor the same access that they would a county agency, and it's really one of the factors that made it so difficult to do. But what you're offering is like a hybrid model to return to that community-based approach where we split up the work and where the community partner really is doing the application. They're taking the application with their citizen who lives near them, and then it's coming to us to process and approve or disapprove. So it's like a two-step process, but for the customer, they wouldn't know. They don't care who processes it. I mean, it's an interesting thought, Dan, and I think it's something we could bring up in our Beacon group, and we could also talk about
Only
it.
if it's helpful. It's
as a
just
part
you're
of
trying
NC
to,
Cares
only if
360.
it's helpful to Philip and it's the system. I mean, it sounds like you're still going to have a staffing problem on the back end to work those. But
Well, but it would be helpful, and I'm also thinking about it from a citizen from a customer service perspective. If I have that relationship with a nonprofit, whether that's Jewish Family Services or Swanano Christian Ministries or Council on Aging, and I can apply for energy while I'm already in there doing something else. And maybe I don't have the technology skills to do it from home. Maybe I don't have access to a computer or internet access that's fast enough for me to do it. I'm just saying it's a great service delivery model, and I appreciate you bringing it up. It's something we can explore next year. And then there's the secondary burden that Philip is talking about of really just processing, because taking an application is one part, but processing is what really matters to get it out timely. In SIP, we have very short turnaround on those cases because it's a crisis. So, it has to be done. What is it now, Kelly? Is it 48 hours?
Depending on the crisis, it can be 18 to 48 hours for the crisis intervention
Yeah.
program.
We only
One
have
thing so
18
that
hours to process that and resolve that emergency. But I just want to say I love your community-based approach, and I think that's something we might could bring up, Philip, at Beacon Group and see if our nonprofits have capacity. The hard thing was if they turn around and ask us for money for this extra work, we're gonna be in the same budget situation. So we wouldn't have money to fund this with the community partners. So that would be like, I think, the challenging piece of it, or at least not right now. We could develop that in the future. But I just want to say thank you for the idea. It's a fantastic idea, and it's one that we've been exploring. Kelly's already working with that when we shifted this year, but we haven't had a lot of time to fully develop it because we just jumped in, great guns to make sure we were meeting the need.
I
I
do just
think-
want to say one of the things with Eblin that we did was to make sure that since our residents have been going to them for so long, if they showed up there, then they could send us a referral form, and then we would either call them or we would do the application online or what have you. So those processes we've been working through. And the other thing, Stoney and Philip can both tell you that I have fought with the state for several years about access to different programs. Child care subsidy and energy were definitely some of those that I have pushed hard for. And it comes down to access and what they can and cannot have as a contractor. And unfortunately, that door was shut firmly in our face more than once. It's not that we didn't fight for it. It's just one of those things that we had to lay to the side for a while.
And I agree, but I think to Dan's point, if you could build that bridge to NC Cares 360, that some of that information may not be, that you're not looking at NC Fast, you're looking at NC Cares 360, and you could maybe grasp that information from a community provider standpoint. I think there's value in that.
Thank you all for that, for that discussion.
Thank you for the discussion and thank you for the report, Martha and Philip. We are moving on the agenda to social work retention and recruitment update. As we know, Rebecca is not with us today, and Mick McGuire is joining us for that update.
Good afternoon. And certainly Stoney chime in, but I have really good news. And the news is that as of today, we offered on our 29th position in investigations, which means that we either have positions filled or folks in the pipeline to have them filled. And although it's only going to be a brief period of time for a couple of weeks, because we're probably going to hire at least one, if not two internal positions for supervisory positions, it's the first time in over 2 years that we can say that we have people slated for all 29 positions in investigations. That's the good news. The tricky news is that the level of experience within investigations continues to be incredibly low. And I did a point in time look at folks yesterday in our assignment log, and we still have 12 staff off of assignment as of yesterday due to caseload max restrictions, having some performance issues. We have 5 or 6 staff that are having some performance issues, and so we have them off assignment. We have 1 staff who's not yet started pre-service, 1 staff in pre-service. So realistically, we only have 18 staff that have been able to take cases over the last little bit, and that continues to be a huge challenge. March is historically our busiest time in investigations, and that remains the same this year. Our volume is incredibly high, and so it continues to be a challenge. February was also incredibly high. I do our state data workbook each month, and our volume was incredibly high in February as well. So although I feel like we're really making great progress towards some of our staffing needs, we continue to struggle with the level of experience within our investigative world, because what happens when those people are off assignment, our seasoned staff get hit even harder, and they have more cases, and oftentimes 4, sometimes 5 in a week, which isn't sustainable given a caseload standard of 10 at a statewide level. In family in-home, we hired our last position, and that person starts next week. And then in permanency planning, we have 2 vacancies currently. They have had some caseload distribution issues as well, because they had 4 FMLAs, 2 of which were unexpected, without sort of any warning. So they've had to reassign 4 caseloads. One of those FMLAs has returned. So coupled with 2 vacancies, that was 6 caseloads that had to be dealt with, but they were able to handle those internally with the use of our lead worker. So we continue to have staffing issues. I will say we continue to recruit, and we do interviews twice monthly. So we do ongoing recruitment to cut down the amount of time it takes to fill positions. It's a tricky recruitment world. This past Friday, I had 4 interviews scheduled, and the week leading up to the interviews, I had 5 cancellations, rescheduled 3. So I had 4, had 5 cancellations, multiple reschedules, and on the day I've had 2 cancellations, and actually only did 1 interview out of 8 total scheduled interviews. And that's a theme and a trend that we're seeing is the market's so hot, particularly here with our unemployment so low, that they're out there interviewing with lots of folks and then wind up canceling because they've taken another position. So that's something that we continue to struggle with as well. Our interview process is fairly rigorous. It's a 2-hour interview process. It's a competency-based interview, and it really helps us get to applicants that can potentially do the work. And we went back to that. We went away from that in October, November, December, early January. just in a need to try to fill positions, and the feedback was that we weren't getting the information needed. So in conjunction with HR, we went back to our evidence-based interview process. Stoney, anything you want to add? I know that Strategy and Innovation has been doing some work, and they did an update yesterday or this morning.
I think, I guess I'd like to start by one thing: you never want to miss an opportunity to celebrate. I would just take a minute and celebrate. While we still have challenges before us, if we think back a year ago, and this board will remember, we were at a 45% vacancy rate in our Child Protective Services section. And we were worried about safety of families. And really, I'd like to continue to thank, I mean, this is HR, we got a lot of support from HR, from our County Strategy Innovation team, from the commissioners, from County Manager's office, to put in a plan to start trying to fix this. And so you guys remember, we paid a stipend. We've been paying a stipend this year to our seasoned staff who are working many, many hours to kind of compensate them for all that extra work. And that will now sunset since we're up in staff. We've expanded our recruiting efforts, and I'm going to applaud Mick a lot here. Mick started personally designing recruiting tools for us. We got out on social media, so we started recruiting different ways. We expanded the qualifications that we would accept. I mean, there was a time in Buncombe County where we really didn't have to recruit. To be honest with you, we got the best and brightest child welfare staff from all over the state. They were all trying to get here, but now it's just a workforce shortage, and so we're actually having to hire people who maybe aren't quite ready in their career for this work, and then we're training them. So we've gone to an approach now where we're building the best and brightest, and that's good, because I'm going to give him another shout out. Mick, in my opinion, and I've been in this business a long time, is one of, if not the best child welfare trainer in the state of North Carolina. So we're very fortunate to have him. So to say that we can build our workforce and bring them along through sort of the old apprenticeship model is a much more comforting thing to say in Buncombe than it might be other places. So we've had to shift. We had to shift our way of thinking and recruiting and training, but we're doing that, and it's starting to work. So that's the thing I want to celebrate. We're not there, but it's starting to work, and we'll continue down that path. We also, in the budget, we don't know till the budget's passed, but we're proposing a new classification for investigative staff. That job is our hardest job to fill. It's very demanding for lots of reasons. And so we're trying to create a new class where we'll now have social worker 1, 2, 3s, and 4s. And that highest level of position will be a child welfare investigator, which should also help us in recruiting, because we'll be one of the few counties, I think, that has it, placed a little bit upper in the classification salary range. So a lot of good things are happening. We're not completely where we want to be, but boy, have we come a long ways in a year. And I would just applaud Rebecca and Mick and her staff and those partners, because on the inside I can see how much work has gone into this, and it just feels good to see fruition. I just want to take a minute and go, wow, woo. So we may not be quite where we want to be, but we are so far ahead of where we were last year and it's great. And I want to thank this board, because you guys were very supportive too, and you really stood behind us in those early days to make sure that our voice was being heard, and it was. Everybody responded well. So, I think we should just take a minute and, celebrate success, right? Every time we get it.
Martha's got her hand up.
And so
And
thank you
Martha
for
has
the,
her hand up.
I'm sorry, did you call on me?
Your hand is up.
Yes, I just didn't know if you had called on me. Okay.
Oh, I'm sorry. Yes.
Okay. Mick, thank you so much for your presentation, and thanks for all of you, the incredible work you folks do. This reminds me of when Philip and I talked earlier in the week, for us to keep in mind as a board the difference between available and budgeted staff, where we can look at the overall budgeted numbers of staff, but at any given time, that is reduced by training, by FMLA, by other sorts of leave, by illness. And so there's never, almost never 100% of staff on board at any given time. And that's an important distinction when we're talking about staffing levels.
Yeah, can I give two more updates, Stoney, that are pretty cool?
Yeah, please.
So one of them is we're the last region to roll out with the new North Carolina Child Welfare Pre-Service, which has been in design and in the works for several years as part of the Child and Family Services plan. And it is rolled out in several regions and with great success and much higher retention of the information. The data suggests it's just going to be a much more robust training program to better prepare staff for field work, which we've been having to supplement in Buncombe because the Child Welfare Pre-Service current version is like 49th out of 50 states in terms of length of time and amount of knowledge sort of gained. And so our new Child Welfare Pre-Service is 7 weeks long with a core component and then a 6-week long component with much more transfer of learning, with a lot of emphasis on the supervisor facilitating these coaching sessions with transfer of learning when they're back in the office each week. Our director, Rebecca, was able to go through the Train the Trainer last week in Charlotte, and myself and 3 of my trainers that I supervise are going to the Train the Trainer in a few weeks here in Asheville. And we are working with the state to create training partnerships for this North Carolina Child Welfare Pre-Service, whereby we will work with state trainers to support Region 1. So it'll be Buncombe as well as the other counties in our region, so that we can really devote more time to practical skills, like what does it look like to go to a person's home and knock on the door versus just learning policy and theory and history of child welfare, et cetera, et cetera. So that's super exciting. And then secondarily, we just got our DCDL, Dear County Director, letter today with some of the results from the workload caseload study. I've only had a chance this morning to read about half of it, but I do think from a statewide perspective, it's going to provide lots of guidance around staffing needs at a county level. And I'm sure that at some point you all hear about that as well once there's more time to review it. I know they're doing a presentation to our workforce design team on Tuesday, the state is, and so I'm eager to hear that.
Thank you so much, Mick. We appreciate the report and are grateful for the progress that is being made and the initiatives that you have implemented. We are now moving on in the agenda to old business, and this is you, Stoney.
I'm going to share my screen. Let's see here. I'm going to. Okay. Last month we talked about oath of office for consolidated boards, and I just wanted to, I sent a lot of this to you. I just wanted to go through it and give you a chance to talk through it and ask questions. And I was pleased to see that Kurt is on the call because while I could certainly give you a legal opinion, I am not a legal expert, and I'm thankful that we have one with us every month. So I think what it boils down to, and I'll speak off this slide. I sent it to you, and I won't read it to you, but I'd like to speak from it because I think the core of the issue is in this opinion from the UNC School of Government. So if you look at a traditional county that's organized traditionally, they have a social services board and they have a public health board. And in those counties, those two boards must take an oath of office. But the difference is, in those counties, a social services board is responsible to hire and supervise and, if necessary, dismiss the director of social services. A director of social services is a statutorily appointed position who acts as an agent of the state. So really is a public official. In the public health side, a traditional board of public health hires, supervises, and, if necessary, discharges a public health director who is also mentioned in statute and has statutory authority, and so therefore would be seen as a public official. In the consolidated statute, things change a bit because commissioners really have one of two options in consolidation. When you bring your social services and your public health together into a single agency, those commissioners have two options. They can serve as the consolidated board, or they can appoint an advisory board, and then the personnel aspects of those duties go to the county manager. So because of that, some counties would interpret that an appointed consolidated board, like we are, really doesn't have to take an oath because the commissioners take an oath. And then they're appointing you just like they appoint so many boards and commissions across the county. But I think the School of Government standpoint would be that you still have some statutory authority. For instance, you can create a public health rule. You can recommend public health programs and social services programs. And so like their point would be that this board really holds the duties and the powers of both a social services board and a public health board outside of the personnel authority over the directors. So the School of Government feels very strongly, if you ask them, they'll say it 100 times out of 100, that the highest route is for consolidated boards to take the oath. So that's the School of Government opinion, but I will say this, it's sort of like, I would say, there's the law, there's what's legal, and then there's what's advisable. So you can drive down the interstate, you can drive anywhere from 45 miles an hour to 70 miles an hour. All of that is within North Carolina law, but it's probably not advisable to drive 45 minutes on the interstate. So it really comes down to that thing. It's really more of a preference. That's the legal aspect. I wanted to just show you what the trends are across North Carolina. So this isn't every consolidated agency in North Carolina, but this is a big swath of them. And you can see it's about a 65-35. So about 2 out of 3 counties choose to have their consolidated board take the oath, while other counties don't. Now realize this doesn't include all the counties where the commissioners serve as their Health and Human Service Board. Mecklenburg would be the greatest example. It's the largest county in North Carolina. Actually, I think they're second now. But their BOCC serves in your capacity. So they don't have to take an oath because they take an oath as a commissioner. So this is not counting the counties where the commissioners serve as the board. So the 2 out of 3 preference would be to take an oath. And then I just wanted you to see what the oath looks like. This is basically the same oath that I have taken, that Ellis has taken. It's very similar to what a commissioner would take. And so when you hear oath, mine can go a lot of ways, but I wanted to see exactly what it is, and it would be simple enough to do. So I'll just give it to the board. I guess if you want, you could make a motion one way or the other that our board is going to take oaths of office or we're not. That would give you a chance for discussion. And again, like I said, it's not something you have to do, and we believe that it should be the board's decision. So I will stop there and let the board entertain a motion one way or the other. Dan, did you have a question before a motion?
Yes, question. Just, is there any downside to doing this? I mean, is there any, like what it seems like there's lots of pros, there's lots of precedent, there's lots of, it seems theoretically like, why not? Why haven't we been doing this? It seems to make sense. We're here to represent our community in an official capacity. But is there any con?
I personally can find no negative aspect to taking the oath. Even if it's not necessary, it certainly doesn't put any more responsibility on the board. It doesn't put any liability on the board. So like I can see no negative aspect to it, but I might defer to Kurt because, like I said, Kurt would be able to speak to it from a legal and a liability perspective and all those kind of things.
Yeah, I would concur with Stoney. I don't think that there is really a downside. I think it's more doing it to make sure, or taking the oath would be to make sure that you are, should something happen, that you are more classified as a public official as opposed to somebody who's not. There's no case law. I'm sorry, I'm not talking into my camera, so you can only get the side of me. But there's no case law. I have not seen anything where a Board of Health member has been sued individually for something that they have done. So I think that there really is not a whole lot of risk, in either decision. I think moving forward is fine and not. I would just suggest that if you do decide to move forward, that we would amend our bylaws and then put that as a requirement that all new members take an oath of office.
Well, that's where I have a question. I think it's a personal choice. Not that I have a problem with the affirmation, but as a group, I'll say this, I affirm to take this oath. So,
Yeah.
you know, can we just use that slip of paper? And if it's something that we personally want to do, put it on there. You know, just a question. The attorney.
Yeah, I think that you could possibly do that. However, I would think that should something bad happen, it would look rather awkward that, let's say half the board decided to take the oath and the other half of the board decided not to. I think that would create a lot of confusion as to whether the board is a public official or not. So I think that you should go one way or the other. I don't think it would be a half measure in terms of affirming or swearing. Did you have a question about that? I mean, because some people don't want to swear on anything, and affirming, and there are many alternative methods to taking the oath, but essentially you were saying that you're going to uphold the Constitution of the U.S. and the Constitution of the state of North Carolina.
Yeah, well, I preferably do affirmations.
Oh, sure. But that would be the same.
Yeah. Okay. That was my question.
So my question is, do we all have to do it if we say we're going to do it? Or we can't have a mixed group, can we? So if we're going to do it, we all have to do it, right?
I would
My
think
advice
that,
is my advice would be just from a practice perspective, and let Kurt answer the legal perspective is, if you do it, it's really a positional oath. It's not a personal oath. So I think it's either part of the board's operating procedures that if you're a board member of HHS, you take this oath, or you don't. I agree with Kurt. It's not a personal oath. It's a professional oath. So it's in your role as a board member. So I think personally, it would either be any board member or no board member would be the cleanest way
Right.
to do it.
That's what I'm asking.
and I would think that if the board as a majority adopts the policy that taking the oath is a positional requirement, then I think that would be something that all board members would have to do.
Martha, I see
Okay.
your hand up.
Yeah, I think about this the way that I do about working for the Board of Elections, because I work elections and you're required to take an oath to work elections because of the basic constitutional importance of the right to vote. This isn't quite as basic being on a Board of Health, but it's still part of the law, and everything we do has to comport with that. So I'm completely comfortable doing it.
I have a question, and Stoney, this might be for you and Ellis. For our accreditation, is there a requirement of oath of office of members?
Not that I know of. Ellis would know that if she's on. Kelly might know as well.
Ellis, you're muted.
Sorry.
No.
Yeah, there's Kelly. Yeah, no requirement.
Thank you.
So, so some boards are doing it, some boards are not doing it. And so I guess my confusion lies in why was it brought up in the first place? Have we already covered that? I mean, maybe it's
Yeah.
redundant.
Yeah, that's a good point, Jackie. I think why I brought it to the board's attention is I'm also the chair of the Consolidated Human Services Alliance in North Carolina, and the issue came up there. And then I think I had personally never realized the School of Government would take such a strong stance on this. I must confess I have a tremendous amount of respect and trust in the School of Government. And this decision was made also prior to any of us. So when Buncombe County consolidated in 2013, clearly the decision was not to take an oath. I felt like when I realized how many counties were and the fact that we were in the minority, I felt like it was my responsibility to bring that to the attention of this board and let you make your own decision. And that's why it came up now. It was out of a project that was done statewide with this with the majority of the consolidated directors.
So with that, thank you. That was a great question, Jacqueline. Thank you for clarifying that. Stoney, is it your impression that there is a desire across the state to have a more uniformed oath policy in this, and that's kind of one of the desires, and that we are now in an outlier position based on various bodies in the state, and it would behoove us to consider not being an outlier?
Yeah, I think that's, I don't know if there's a big desire to get it all the same. I think what you'll see is the consolidated statute that was approved in 2012 was put together very quickly, and it was pretty political, and it really was not built out, I guess I would say. So when you consolidate these two very large service systems in North Carolina into a single model, there was never really any work done to talk about the nuances of what it's like to do it from an integrated, consolidated approach toward the more traditional approach in North Carolina. And I would say now, if you look at population, there's about 26 consolidated counties. There's still 74 non-consolidated counties. But the interesting thing is most of the population of North Carolina is now consolidated, well over half, because you have Mecklenburg's consolidated, Guilford is consolidated, Forsyth is consolidated, Buncombe, Union, Gaston. So a lot of your urban counties are consolidated. So I think consolidation gets more attention in that respect, especially when you run into legal questions like this and no one answered them in the law. And so I think that what people are really desiring is probably some clarity around when you have these things, but nobody has really gone to like clean up the law, for lack of a better word, and build more, put some flesh on that skeleton. But it also gives a lot of freedom. So it gives a lot of local freedom. And so but my thought is, if the question is out there, I want you to make the best decision for this board. That's your responsibility. And you didn't get to vote on this when we consolidated in 2012. And so I think it's fine, whatever you choose, but I just think it's, like I said, my responsibility to let you know what's happening, what the current legal opinion is, at the School of Government, who consults with counties, and then just let you choose what path you think is best.
So you bring up, if I'm, we may be going down too much of a overkilling this idea, but you just said something that maybe I shouldn't bring this up, but in the politically divided world we live in, if all of the cities are doing it a certain way that does not have an oath of office, and all of the rural areas are doing a way that does have an oath of office, you could imagine that there might be a political reason to use that as a wedge between city and rural. Knowing that there are persuasions in the rural areas that are one political party and persuasions in the city that are another political party. Does that at all come into this conversation at all as a concern and the validity of decisions of HHS from a city standpoint, as we know how contentious these decisions were with COVID and all this stuff? I mean, it's just all of a sudden, it's just like, wow, maybe this is a point where we should just try to all be the same and not have that as be a wedge.
I don't think so. I mean, I think that's a good point. I think that's a logical thing to think of. But if you look at the consolidated counties across North Carolina, I was mentioning that many of the large ones are consolidated, but there's also just as many small rural counties that are consolidated. And I don't really see all that consolidation occurs necessarily across party lines. It usually happens locally for one or two reasons, to be quite honest with you. Is a county will consolidate because they really want to move to a more integrated, whole person approach to serving their community. That's the right reason to consolidate. Some counties consolidate because they think it will save them money. The research and the data would suggest it really doesn't save you money. It's just a different governance structure. And then honestly, early on, some counties consolidated because, I'm just going to be honest because it's truth and history's out there, some county commissions wanted to have more power and control over their social services and their public health, because when those sat under standalone boards, it sometimes, could create differences of opinion. So it was a way to bring those two agents of the state entities into more of a county government approach, which is a lot more seamless, so you're really kind of all in there together. So like those are the three reasons I've seen in my history, and I've studied a lot why counties consolidate. So when I say it was political, I mean it was a big political fist fight to get the consolidated statute, because prior to that, only 3 counties could consolidate by law. And that was the 3 largest counties in North Carolina. And a lot of smaller counties were saying, we'd love to do this too. It makes honestly more sense in the small counties sometimes, because I know counties that just have one single director. Their director really is the public health director and the DSS director. They hold both titles. So I think it allows for organizational, freedom in counties. And in North Carolina, there's a long history of counties wanting freedom when it comes to state services. So that might be more history than you wanted, but I don't sense that it's political today. I really don't, and it certainly is in an urban rural. When we have consolidated alliance meetings, I'll be sitting in there with counties that have a million citizens, and I'll be sitting in there with counties that have 15,000, and we'll be working together. So it really is pretty apolitical at that level.
So friends, my question is, do we want to entertain a motion to do a oath of office for board members, or do we want to continue discussions?
I'd like to know if anybody really, really disagrees with this. Is there any dissenting, kind of feeling out there?
I do not disagree with it. I'm ready to do it. I go with the School of Government on this.
I don't have any reason not to take an oath of office.
Yeah, I think long-term for future incoming members, I think that is a good step for us to take.
Yes.
So somehow I'm hearing a motion in this.
Not yet, not yet, not yet, Lucy.
I know, I'm priming the pump here, Dan.
Well, I'd be willing, I'm very, this is actually, this could be one of those that, I just want to be sensitive. If there is somebody with a strong opinion that is not speaking up, like it's important to speak up and I think be validated that we don't have to do this, but if nobody speaks up, that we're probably going to do this. And so I just want to make sure that there's nobody with a strong opinion out there that we didn't have an opportunity here.
I agree with you, Dan, and I wonder if there is someone with a strong opinion who does not feel comfortable just talking about it right now, if there's another avenue for folks to do that.
Well, with that, Martha, if that's so then I would suggest, is that we table it for one more meeting with the strict, kind of recommendation that anybody who has a dissenting opinion, please make that known.
And who do they need to make it known to?
I don't know. I'm not the board leader.
I would say the chair.
Yeah, I would think to me, and that can be absolutely anonymous.
And if that happens, then what do we do? Does it have to be unanimous for us to do it?
Well, so then we can decide that. But I think it's a little bit, since we don't have to do it. And this is just my feeling. Since we don't have to do it, it would be a shame if we alienate somebody unintentionally. And so like if Lucy gets, one or two people, she can say, hey, there's one or two people who feel really strongly against this. And then we can have another discussion whether that matters to us or not.
On the other hand, if we're looking to the future and we think that for future incoming individuals, this may be a good step for the board. Is there a way for however many people who don't agree for them to be grandfathered, and then at the time of they renewing their commitment to this board, then they'll be able to decide whether or not they will take the vote of office or whatever it is we're talking about. They will do it or not. So I think it proposes, like, if we vote and then individuals who do not choose to take the oath of office, they could be grandfathered in, and at the time of the renewal, then they can make a decision whether or not they're gonna stay and renew or not. But for the future, I think this is a good step for the board.
Okay, so what I am hearing is tabling any vote for right now and providing people the opportunity to reach out to me, and I will keep identities anonymous, and then we will revisit this in our March meeting. No, wait, this is March, April, thank you. Our April meeting, and move forward from there, possibly with a vote.
We can do that, but Stoney, also, are you planning on in July presenting like amended like rules of procedure like we do normally every year? We have the board.
Yeah, we always look at them, Kurt. So at our July meeting, we entertain any changes to our board operating procedures. And I agree with you, if the board voted to do this, we'd need to amend our board operating procedure to reflect
So I don't know whether that might also be a time to let it marinate, because we'd have to amend the thing now and then we'd have to approve it then in July too.
Yeah, that's a good thought.
So just something to think about, everybody.
If that was the case, Kurt, we would vote on it in July or prior to July?
Well, basically you could do it prior to July. And what you would need to do is amend your bylaws, which basically I think would be membership. Which would basically say that you have to be a resident of Buncombe County and that each member must take an oath of office pursuant to, I think it's Article 7 of the North Carolina Constitution. I'll get the proper site, prior to taking office. Or prior to taking office.
Is it in July? Does everybody renew membership then? And then that would answer Elizabeth's, like
I think you all have very different terms.
different terms.
Yes, we were
Not a
just
term.
discussing that.
Yeah.
And we have staggered rotations.
Yes, but I think it would be that once you take it once, if you were renewed the second time, you wouldn't have to take it again.
Right. Okay.
Yeah, I would agree. I think it would stand for the tenure of your board. Like, I've taken an oath. I don't take one every year. I just took it when I was appointed. And then, it'll last as long as I'm the Health and Human Services Director in Buncombe County. If I were to go to another county, I would have to take another oath. It'd be the exact same oath, but I'd have to take it as an official of that county.
Okay, so I think we are officially tabling and percolating.
And I will work with Stony and we'll get like a proposed amendment to the bylaws so you can actually see what it looks like.
That would be helpful. Thank you, Kurt.
Okay.
I just want to thank,
All right.
I just want to thank Elizabeth for that suggestion. I think it's a great suggestion.
All right, so we are moving on to new business. And this is a nomination for a new board member. Current board member Savannah Lamb has recruited Elizabeth Stockslager, Betsy, to be a member at large for the board. And our exec committee had the pleasure of meeting with Betsy last week. Betsy is eager to serve the community in a role on the board and sees her role on the board as an area for her to learn from. She has been in public education for 20 years, specifically in early childhood education. She has worked for both Buncombe County and Asheville City Schools and is currently the Buncombe County Schools preschool director. She has worked with a local early childhood grant, and that is to prepare individuals for employment in early childhood development, and found that to be very political, and as such has learned to navigate multiple networks in our local community. She, I think, is very connected and knows and has experience supporting child development centers and their families, and will be a voice for our youngest citizens. Exec board, I don't know if I'm missing anything else from our conversation with Betsy.
I think you pretty well covered it, Lucy.
Thank you.
I've recently gotten to know Betsy since I've come back to do contracting, and she is quite competent, is very, very good and very knowledgeable about preschool.
Will she take an oath of office?
I don't know. Haven't asked her.
That wasn't part of the interview process, Dan. but we can make it one.
She did express some concern. She's in a grant position, and should that grant position be defunded, so to speak, she was concerned that she might not have a place on the board, but I'm comfortable that her experience and knowledge of childcare will be valuable regardless of what position she's in. So I did not think that was really all that much of an issue myself, but she did bring that to our attention in the executive committee meeting.
Well,
And
she's
she
a
will
member,
be
she's a
taking
member at
on-
large anyway, right? I mean, so it's
Yes,
just
a
any,
community member.
she's just a community member
Right.
that doesn't change regardless of what she's doing.
Well, that was a concern of hers that she expressed, and so I felt comfortable reassuring her that her knowledge and experience was useful regardless of her current funding position situation. That was my opinion.
I would like to ask the body if there is a motion and a second to approve Betsy Stockslager.
I'll make a motion to approve Betsy.
Thank you, David.
Doesn't the motion come from the executive committee?
Oh my gosh, does it?
Yeah, it does.
Okay, I am moving that we approve Betsy Stockslager as an at-large member of our board. And David, I think that you seconded that.
I could do that.
All those in favor?
Aye.
Any opposed? Thank you, and we will invite Betsy to join us for our April meeting. All right, Stoney, director's report.
Yeah, I just have a couple of quick things, mostly announcements. You mentioned something about July, and I just wanted to let the board know in advance. So last year, we do have to do an annual board training every year, and that training can shift year to year a little bit. It will always have a lot of public health information in it because it's a part of our public health accreditation. So like, it's a requirement for accreditation. But there's also some talk about a statute that's going to require annual training for social services board members. And again, we're back to consolidated thing. If either one of those boards get mentioned in statute, it applies to you as a consolidated board. But this year's training, I'm pleased to announce, will be in person. So last year we had tried a model where you did it at home online virtually. I understand it was a little bit cumbersome for some of you. So this will be the crux of our July meeting. So we'll spend the majority of that meeting doing annual training with you and also doing our annual things like voting any changes to the operating procedures and electing our chair and vice chair. So just wanted to make that announcement so that you would know what's coming up. And then also just a few upcoming events for April that will occur before we meet again is on April 2nd, there'll be a Commissioner's Proclamation about National Public Health Week. So we'll be recognized Commissioners meeting on April 2nd. Then on April 11th, actually, we're really excited that Buncombe County is sort of co-hosting a summit on NC Cares 360, which Dan mentioned earlier in the conversation about NC Fast. It's really a resource and referral platform that nonprofits can use, government entities can use, and it's really around what I would call those social determinants of health services. So it's really, the summit actually is getting publicity and interest statewide. Like I happen to know people from Charlotte are coming up to attend this summit to see what's going on. So big shout out there. I actually give a big shout out to Dan and ABCCM because they've been real champions for this for years, this platform, especially in their veteran space, and now are really being champions. Dan as the lead of the Safety Net Coalition and ABCCM just as a subject matter expert. So we're really excited about that summit on the 11th. You are welcome to attend if you would like to. And then on the 16th of April, we'll be honoring Child Abuse Awareness and Prevention Month. So at 10 a.m., we'll have a very short ceremony at the Energy Loop right there on 200 College Street. And Mountain Child Advocacy Center is a big part of that. So they're like co-sponsors of that event along with us. And then that evening, the commissioners will issue a proclamation as well around child abuse prevention. So those are just some news and happenings for April. Just like to keep you guys in the loop on what's going on out there in our like marketing campaign kind of activities.
Stoney, would you
Yes.
mind, would you all mind sending out events by the month to us in case
Yeah.
we're able to come to them? And would you please let us know when you would really like a board presence as something you've done that in the past, but please keep doing that, especially if there's something that's really important, like a county commissioners meeting that needs board presence.
I sure will. Absolutely.
Okay, so on to my report. As you all know, we have been putting out the word that we are in search of 2 required positions on the board, that of a dentist and the other is an engineer. And we have some leads on that and hope to be able to bring some people into our next exec meeting in April. And I am eager to hopefully bring those names forward to you all at our board meeting in April. That is all of the business that we have for our March meeting. And I will entertain a motion to adjourn and a second, and all those in favor, we will see you next month. Okay, so I guess I'll just pick somebody as the first and second.